begin the flu season in the Northern Hemisphere during the months of October to May of the following year. And as such, Trinidad and Tobago has received its first shipment of influenza vaccines for the season via the Pan American Health Organization. And we just wanted to give some brief information to update the population as to the signs and symptoms, the transmission, prevention, the target groups we're looking at for vaccination, where to get the vaccine, and of course, some final updates related to the vaccine supply and some intricacies about when to have it in relation to the COVID vaccine. Influenza is a contagious respiratory illness caused by the influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. And we have seen deaths in this country from influenza in the past. Prior to COVID in 2019, we would have had quite a increase in number of deaths in that particular year, where we had 40 cases coming to the end of the flu season, the beginning of the flu season in 2019, followed by a subsequent decline. The flu season generally starts, as I said, around October to May in the Northern Hemisphere. It's the reverse as it related to seasonality in the Southern Hemisphere. So signs and symptoms are very much like COVID. They're very similar to the common cold as well. So you get fever or feeling feverish, chills, cough, sore throat, runny nose or stuffy nose, muscle or body aches, headaches, fatigue, in rare cases vomiting and diarrhea, which tends to be more common in children. So it is transmitted very much like COVID-19 by respiratory droplet infection. Particles are inhaled when persons sneeze or when they come in contact with a contaminated surface. So touching fomites, which like doorknobs, desks, etc. And the measures we have put in place for COVID-19 are doing well to control both COVID-19 as well as the spread of the influenza virus. So take the new 2021-22 flu vaccine following the Ministry of Health's public health guidelines will also help with decreasing the rate of influenza circulation within the country. Wearing your mask, covering your mouth and nose when you sneeze or use a tissue, wash your hands with soap and water, avoid close contact with people who have flu-like symptoms, maintain social distances. If you have symptoms, of course, you seek immediate medical attention. If you experience difficulty in breathing, chest tightness, inability to eat or drink, and persistent vomiting or confusion, those are warning signs that you need to get to a facility or seek medical care urgently. So why vaccinate every year? The new vaccines are released every year to keep up with the rapidly adapting and rapidly changing. We have come to learn about mutations in viruses. This is common for the flu viruses. They mutate, and generally speaking, the vaccine that we have this year is adapted based on the mutations that would have been found from last year's circulating viruses. So when you get vaccinated, your immune system produces antibodies to protect you from the viruses, including the vaccine. And antibody levels generally, as it relates to the flu vaccine, declines over time. So you get a new vaccine taken every year to ensure that your antibody levels keep pace with the changing viruses that are circulating. So this year, we received through PAHO, protecting against 4 strains of the influenza. So the influenza virus, generally speaking, has 4 different subtypes, A, B, C, and D. A and B are of concern to humans. D is really an animal disease to the most part, and type C is generally very, very mild and therefore doesn't cause significant severe issues in the human population. So we focus on A and B. A, again, these are the strains that are included in the vaccine. So we have 4 subtypes, and this is based on the main strains that would have circulated last year. So we have A Victoria 2019, H1N1 swine flu. We have A Cambodia, H3N2, which is the bird flu, and 2 of the type B. So this is our target population that we're looking at, and this is what we call our high-risk groups. So children aged 6 months to 5 years of age, adults over the age of 65, and we can look at above 60 as we did for COVID-19, persons suffering from non-communicable diseases, diabetes, hypertension, asthma, and the like. Pregnant women, again, have a slightly higher risk in terms of complication if they do get the flu. Persons with compromised immune systems, HIV and lupus. Persons with chronic respiratory illnesses, asthma and COPD. Persons who are overweight or obese. healthcare workers because of their exposure risk, and members of national security, customs, and immigration, again, because of their high exposure rate. So benefits of the flu vaccine, again, keeping you from getting sick with the flu. It does not prevent all infections, but it will decrease the severity and the risk of hospitalization and possibly death in persons who would have taken the vaccine. Again, protecting women during and after pregnancy as well. So where will they be available? So I just confirmed with my manager of the EPI program. Distribution began on Monday and has been going on throughout all counties of the country. The last county should pick up their vaccines today. So from tomorrow morning, all health centers throughout Trinidad and Tobago will have a supply, and you'll be able to access your influenza vaccine at any health center, as well as the Sentinel physicians, which are private physicians who form a part of our Sentinel physician program. Those will be available from early next week, hopefully by Monday. And we're asking the Sentinel physicians to reach out to your CMOH offices, as per usual, so that you can pick up your supply of vaccines as well. Health center times throughout Trinidad, as you know, are usually 8 to 4, Monday to Friday for most health centers across the island. In conclusion, COVID-19 and influenza viruses are similar in transmission, symptoms, and treatment. Therefore, as we enter the flu season, it is obviously difficult to differentiate the two, even for a trained clinical person. So we present if we have deterioration of symptoms. We will possibly be swabbed to see if it is COVID-19 to rule it out as well. We can also test for influenza strains at the Trinidad and Tobago Public Health Lab and the Caribbean Public Health Agency. Continued social distancing, wearing the face mask, and of course, if you develop any of the symptoms and you're concerned, contact your nearest healthcare facility as soon as possible.